So in the last 5 years, we've been working to develop new models of rehabilitation for people in our service. And one of the reasons that we wanted to do that is that we've been doing lots of work on well-being, and really the research shows that well-being is not the absence of impairment. And lots of the models that we use in healthcare and in neuro rehab are about reducing impairment. And of course, lots of the difficulties people face after brain injury are long-term and permanent. So in order to help people experience well-being, we also have to focus on helping them live with some of those difficulties. And so we wanted to create services that not just aim to reduce difficulties, but also help to promote well-being. And so we've ended up doing lots of research and publishing some theoretical models about what actually the core components of well-being are. And lots of the work that we've published has talked about how important social connection is. And obviously that's very important for people with brain injuries because they can become very disconnected and socially isolated. It's also talked about the importance of health behaviours like healthy diets, exercise. And we know again that people with chronic conditions can find it difficult because of the limitations of their condition to engage in health behaviours, as well as positive experiences being really important for well-being. And very often after brain injury, people say that they've got limited opportunities to experience positive emotion and positive experiences. So at the heart of what we're doing now, we're trying to put interventions in place that promote health behaviours, give people opportunities for positive emotions, positive experiences, and connections with others. So we've developed a series of groups. I mean, I guess by means of an example, we've developed a group with a construction company in Swansea, because we've got a lot of young patients that want to develop practical skills and want to be able to return to work. And the construction company work alongside us. We input the rehabilitation and they teach the people we work with practical skills in plastering and building and renovating houses. And together we kind of support people to gain new skills and experiences that feel meaningful for them. And the important thing about that example is that it's about working with community providers and businesses to help bridge the gap between healthcare and the community, so that we end up helping people integrate into their communities in order to promote sustainable well-being in the future. One of the things that I find most challenging about working in neurorehabilitation can often be this conflict between the kind of the medical model, which I've talked about, which inherently there's an assumption that you're the expert and you're treating somebody that's a patient. So there's an imbalance of power in that relationship, and that you can do something to that person to fix their difficulties and return them to a pre-injury state. That model works exceptionally well for acute medical conditions, but it's been inadvertently applied to chronic conditions. And sometimes that's a real challenge, because I think we'd be doing a disservice if we only aim to reduce impairment rather than promote well-being and help people live meaningful lives after their brain injuries. And that can be quite challenging because you work with lots of different professions and some of them are very much trained in that model, and then you've got other professions that aren't. And I guess it's about, one of the challenges is about trying to find some common ground for how you can develop more holistic biopsychosocial models of care that support the whole person.